pharmacies are being sent thousands and thousands of doses of AstraZeneca for second shots, but the reality is a good portion of their patients will likely opt for Pfizer instead. So what will happen to the leftover AstraZeneca vaccine that pharmacies don't administer? Is there any plan so it doesn't end up going unused?
So thank you for the question. In terms of the vaccine management, what we would do with leftover vaccination, actually, or vaccines, I'm not really sure what the plans for them would be, but I would say that the vaccine supplies are actually being managed quite carefully, and there's good planning in place to make sure that the supply and the demand are well matched. And we do know that lots of people who received AstraZeneca vaccine would like and are ready to receive their second dose of AstraZeneca vaccine. It is a highly effective vaccine. People have had good experiences with the vaccine, and they know that there's good data showing that 2 doses of AstraZeneca vaccine provides good protection.
Dr. Gustafson, as you noted, British Columbians that received AstraZeneca are starting to be able to book their second shots today. Some are being told they have, somewhere between 12 and 18 hours to make a decision about whether they're going to get AstraZeneca as a second choice. I'm hearing from a lot of people different reasons for why they are still concerned. Will the province provide any additional guidance to people to help make their decisions for whether they should receive AstraZeneca as their second dose or if they should go with the mRNA vaccine?
So yes, thank you for your question. Yes, there is information available to people, and that information is quite detailed. It's detailed on the effectiveness of the vaccine. It's also detailed, provides detail on the risk of the blood clots that some people are concerned about, both after the first dose and after the second dose. Data from the United Kingdom indicates that after the second dose, the risk of that blood clot is about 1 in 600,000, as well as the evidence that we have for effectiveness of the mix and match schedule. We know that we now have studies that tell us that it's a safe thing to do, that you may get some more local reactions, and that the second dose of that mRNA vaccine does provide a booster reaction. And that booster reaction is important. That's what we're looking for in a second dose of vaccine. So in the information provided to patients, all of those details are provided for them so that they can make an informed choice.
Richard, do you have a follow-up?
One of the things people are grappling with as well is the timing. So, Dr. Gustafson, will the province provide details to people on when they will receive their second dose? For example, if they received AstraZeneca on April 15th as a first dose, they will receive AstraZeneca on this day as a first dose, and they will receive an mRNA on this day as a second dose. Can the province provide this detail to people so they can understand when they may be able to be immunized with either one of the types of vaccines?
So I would say that with the largest immunization campaign that we have ever run in British Columbia, that kind of precision is unlikely to be available to people. We are informing people about when groups of individuals will be invited for a second dose of vaccination, as well as general parameters about when groups of individuals are going to be able to receive their vaccine. And of course, it all depends on vaccine supplies, which are being managed in British Columbia, in Canada, and throughout the globe in real time. So that level of precision, while not available, I think what we can assure people of is that, again, as soon as vaccines arrive, groups of people will be receiving their invitation. And I'm actually really glad to hear that people are anxious to receive that second vaccine, and there are no delays certainly implemented or intentional delays for anyone. Our goals are the same. We hope to deliver the vaccine to people as fast as possible, and people are hoping to receive it as fast as possible. And I think Minister Dix has something to add to that.
Just the priority for second doses, as you know, Richard, is the same as for first doses, and we've seen that. People living in long-term care, assisted living, and other congregate settings had high priority for first doses, and many of them now, the majority, have had their second doses already. Other healthcare workers as well, and then those that are clinically vulnerable, who started were able to book for their appointments on March 29th. Many of those have now booked their second doses. I believe in those categories are elders and those who are clinically vulnerable. There was, I think, in the days when we opened up more fully for second dose, about 450,000 invitations sent out at that time. And so the invitations will be sent out on a regular basis, and then people will book their appointments as they did for the first doses.
Going back to second doses for people who received AstraZeneca on the first dose, do you expect people if people select AstraZeneca for their second dose to receive it faster than they would if they select mRNA? And what is the reason, if you could just explain to the average person making this choice, what is the reason for giving the option of that mRNA second shot when NACI has said that it's always preferable to have two of the same vaccine?
So thank you for your question. So with respect to when you will receive your vaccine, again, it depends on when your turn comes up as a second dose based on your age. And again, AstraZeneca vaccine recipients have started receiving their vaccine or their invitations for that AstraZeneca vaccine. With respect to the AstraZeneca vaccine, I think it is important that patients have the opportunity to consider all of the factors that go into that decision. And one of the important things about AstraZeneca vaccine and having the same vaccine is that first of all, we know that generally we prefer for people to have the same vaccine of the same dose. However, we also know that there are some people who are concerned about that risk of blood clots that is very low, but at the same time that is a concern for some individuals, and we certainly wouldn't want anyone not to get a second dose of vaccine because of that concern, so that option is provided to them. But we also know that the most robust studies about effectiveness come from 2 doses of the same vaccine. So we are all going through this pandemic together. We're watching the data come out, and we provide the fullest information for individuals, and I think given those different factors, actually either choice is a reasonable one for an individual to take. As long as they receive that second dose, either choice is reasonable. We are providing all the information we can for individuals to make health choices for themselves. The most important thing is to get that second dose.
Moira, do you have a follow-up?
I do, thank you. In terms of that, making that choice, is there a situation under which you would recommend someone who had received a first dose of AstraZeneca to receive mRNA, such as for people with increased risk factors of VIIT? And with you mentioned previously the rate of blood clots for second doses. Is there any reason to assume that it is higher for second doses than it would have been for a first dose?
So, interesting question and important question. There are actually no particularly well-identified risk factors for this rare side effect, and therefore there isn't a risk factor that would make us not recommend someone to receive a second dose of AstraZeneca. But the only reason we would not recommend a second dose is if somebody actually did develop this rare outcome, in which case we would not recommend a second dose, or if they had another serious side effect of any vaccine, such as a serious allergic reaction, then we would not recommend that they receive that same vaccine. Both of those are very, very rare outcomes, and no, there are no other risk factors which would indicate for us that or cause us to recommend someone not to receive a second dose of AstraZeneca.
Dr. Gustafson, you heard today that many people who received AstraZeneca as the first dose are still trying to determine whether to get AZ for the second dose as well or switch to an mRNA vaccine instead. That data from the UK suggests that 2 doses of AZ are 66% effective against COVID, and 2 doses of either Pfizer or Moderna are 93% effective. Do you have any data on the effectiveness of 1 dose of AZ plus 1 dose of an mRNA?
Thank you for your question. That's a good question, and effectiveness data are not yet available. Effectiveness data require time, where people who received one schedule of vaccine versus another schedule of vaccine have a period of time that's during which there is a potential for being exposed, and we can measure who gets COVID-19 and who doesn't get COVID-19. And that kind of data takes months to acquire. What we do know, and sometimes years, what we do know now from data with the mix and match studies is that it's safe to do that, and that indicators of an immune response, which means that there's measurable antibody that follows that mix and match vaccine, is measurable and is produced through the mixed schedule. So we do have good indicators from this schedule and parallels with other vaccination programs that tell us that either choice is safe to do and will provide you with protection. With the efficacy, the kind of data that you are comparing, that is not yet available for the mix and match studies. And I would actually also be very careful about comparing those between AstraZeneca and Pfizer or Moderna, because all of those studies were done in different populations at different times with different levels of COVID-19 circulating. What all of these data tell us is that all of these vaccines provide good protection against COVID-19.